Hi, I'm Mike Gurr. I'm the Executive Director at the Meadows Adolescent Center. So the atmosphere at the Meadows Adolescent Center is unlike any other. It literally was a home. And so we have transformed this home into a place of healing. We're seeing an uptick with anxiety, with depression, with trauma, with substance, with suicide. If you take a look at maybe where we were at as kids and where these kids are at, they're exposed to so many more things and even at an earlier age. We are starting to get further and further apart. And when I struggle, guess what I actually need? I need to be connected.
With the adolescents, it will be a little bit different of an approach. Since their brain development is still in those stages of being developed, being fine-tuned, we do need to take a different approach with them. We're going to be there to help support them, teach them skills, help them learn different techniques, while also doing some different brain mapping from assessments we'll be doing to help really pin down the underdeveloped parts of their brain, to help individualize the treatment, to help them be more successful in completing our program.
The primary therapist will be kind of this hub of everything that's going on. They'll get emails, they'll get phone calls from the primary therapist, have a weekly family session as well. So between the different sessions, between the phone calls, they'll have really constant communication as to what's happening with their child.
Well, a lot of times we will find what's underneath is trauma, whether that's, one big incident of trauma, whether it's developmental trauma, but that's what we want to get down to, is that core to really help them to heal.
As we're working with adolescents, we think it's so important for them to be active. And they'll be able to do hiking, fire building. We have a high ropes and a low ropes course. We also have a rock climbing wall. We have our equine, so they will take care of the horses. They'll be educated on how the safety and how to groom and how to clean the horses. They'll do therapy work in that area, and then we'll also utilize the 120 acres for riding.
Adolescents are the future of tomorrow, right? So we want to make sure that they feel like they're at home while they're away from home. So we're going to provide a compassionate environment for them so that they can build rapport and trust with the staff to help them in their recovery process. So nursing is an integral part of that because we're with them 24/7. We teach them the coping skills that are so important so that when they leave, they have that tool bag that they can draw from that helps them with the struggles of life that we all see.
Change can happen, and that's one thing I will say to the parents. I know it may feel like it can't because they've been in this crisis and it feels like it will never end, it will never get better, it just keeps getting worse. But I've been doing this for over 2 decades and change happens. There is that hope, right? There's a hope for you and there's a hope for your child. And as you bring that hope together, then family systems can truly change and heal.